All right, here we are about 4 months out after a total knee replacement. This patient's complaining of some stiffness in the knee. You can see the wound looks pristine, no signs of infection, no redness or warmth or evidence of wound dehiscence. There's not much fluid in the knee, but she's just a little stiff. She's about 4 months out. You can see the pre-op range of motion is about 0 to say 100 degrees there. So we talked to her about just, allowing her to continue with physical therapy, or we would contemplate doing a gentle manipulation under anesthesia. So what I like to do is first mobilize the patella. I like to move it medially, laterally. First of all, make sure it's moving well, to make sure we're not dealing with any significant arthrofibrosis. Now, this patient is status post knee replacement, but before that, she had an arthroscopic procedure. You can see the portal sites right there, so there could be some scar tissue from that as well. In any event, we just want to work with her to try to expedite her recovery, to make sure that she progresses and we can move her along more expeditiously, do a little physical therapy here in the operating room while she's sleeping. She won't feel any pain or discomfort. Our anesthesiologist did a preoperative, preemptive regional block to try to minimize any postoperative pain, blocking the nerves in the area so that she doesn't really feel the manipulation under anesthesia either now intraoperatively or postoperatively much at all as well. So here we're going to do a gentle manipulation under anesthesia. So I asked the anesthesiologist to keep her very, very relaxed, which we are. We lower the table as much as possible, and I very, very gently sort of lean on her. You can see her reacting a little bit. She won't know any of this when she wakes up, but I just already felt some scar tissue break, which is nice. I saw the preoperative range of motion. Extension was never a problem. She has beautiful extension. In an effort to try to improve her motion before surgery, we had her in aggressive physical therapy. We also ordered what's called a dynamic splint. She's been very compliant with the dynamic splint, but certainly nothing works as good as us performing therapy while she's under anesthesia. So look at her motion now. You can see a dramatic improvement. Jimmy, come on this side and take the picture on this side as well. You can see how much this knee is moving after knee replacement surgery now. So we basically got her at the 1 year mark, only now 4 months after surgery. If you compare and contrast to the normal side that was never operated on, essentially the symmetrical same range of motion. So we're very happy with this outcome, and we're done. Patient can wake up now. The whole operation took about 3 to 4 minutes.